I'll begin with something that surprises many people. Most seniors know that blood pressure matters, but very few realize just how dramatically the risks change after the age of 60. The same blood pressure reading that might seem manageable in a younger adult can have very different consequences in an older body. That's because aging affects nearly every part of the cardiovascular system, often in ways we don't notice until a problem develops. As we get older, our blood vessels naturally become less flexible. In our younger years, arteries are more elastic, expanding and contracting easily as blood moves through them. Over time, however, those vessels gradually stiffen. When that happens, the heart has to work harder to push blood throughout the body. This extra strain often causes the top blood pressure number, known as systolic pressure, to rise. What makes this especially concerning is that many seniors feel completely normal while these changes are occurring. High blood pressure is often called the silent killer for a reason. It can quietly damage blood vessels, the heart, the kidneys, and even the brain without causing obvious symptoms. A person may wake up feeling fine, go about their daily routine, and have no idea that their blood pressure has been elevated for months or even years. This is one of the biggest misconceptions I encounter. Many people tell me, I don't have headaches, or I feel healthy, so my blood pressure must be okay. Unfortunately, blood pressure doesn't always announce itself. In fact, some of the most dangerous readings occur in people who feel perfectly well. Another important factor is that aging increases the likelihood of other health conditions that interact with blood pressure. Diabetes, kidney disease, high cholesterol, and heart disease become more common as we age. When high blood pressure is added to the mix, the risks multiply. Blood vessels that are already vulnerable become even more susceptible to damage. The heart must work harder. The kidneys may struggle to filter waste effectively, and the brain may receive less consistent blood flow, increasing the risk of serious complications. One of the most feared outcomes is stroke. Elevated blood pressure is one of the strongest risk factors for stroke in older adults. Over time, excessive pressure weakens blood vessel walls and can contribute to blockages or bleeding in the brain. The consequences can be life-changing, affecting speech, mobility, memory, and independence. Heart attacks are another major concern. High blood pressure forces the heart to pump against greater resistance every day. Imagine carrying a heavy backpack every moment of your life. Eventually, the extra burden takes a toll. The heart muscle can become thicker, less efficient, and more vulnerable to disease. What's becoming increasingly clear through research is that blood pressure doesn't just affect the heart and blood vessels, it also influences brain health. Uncontrolled blood pressure has been linked to cognitive decline and memory problems in later life. In other words, protecting your blood pressure may also help protect your ability to think clearly and remain independent as you age. This is why understanding your numbers is so important. Blood pressure isn't just another measurement taken during a doctor's visit. It's a window into how hard your cardiovascular system is working every single day. The goal isn't simply to avoid a crisis. The goal is to preserve quality of life, mobility, independence, and long-term health. As we continue, we'll look at which blood pressure readings concern cardiologists the most and why certain numbers deserve immediate attention. Because after 60, what you don't feel can sometimes be more dangerous than what you do. The greatest danger isn't feeling sick, it's having dangerous blood pressure and not knowing it. To understand which blood pressure is most dangerous for seniors over 60, we first need to understand what those numbers actually mean. Every blood pressure reading contains two numbers. The top number, called systolic pressure, measures the force of blood against your artery walls when the heart beats. The bottom number, called diastolic pressure, measures that pressure when the heart relaxes between beats. For many older adults, the systolic number becomes the primary concern. As arteries lose flexibility with age, that top number often rises. While a slight increase can be a normal part of aging, there comes a point where cardiologists become deeply concerned. And the reason is simple. The higher the pressure, the greater the stress placed on every major organ in the body. One of the biggest mistakes people make is assuming that dangerous blood pressure always causes obvious symptoms. They expect severe headaches, dizziness, or some kind of warning sign. But in reality, some of the highest readings occur in people who feel completely normal. I've seen individuals walk into a clinic feeling perfectly fine, only to discover blood pressure levels high enough to put them at serious risk. This is why routine monitoring is so important. Blood pressure isn't something you can accurately judge based on how you feel. Your body can adapt to elevated pressure for years, even while silent damage is occurring behind the scenes. When blood pressure remains significantly elevated over time, the heart is forced to work harder with every beat. Think of it like driving a car uphill all day, every day. Eventually, the engine experiences wear and tear. The same thing happens to the heart. The muscle thickens as it tries to compensate for the increased workload. At first, this adaptation may seem helpful, but over time, it can make the heart less efficient and increase the risk of heart failure. The blood vessels themselves also suffer. Excessive pressure can damage the delicate inner lining of arteries, creating conditions that allow plaque buildup to progress more rapidly. This narrowing of the arteries can reduce blood flow to critical organs and increase the likelihood of heart attacks and strokes. For seniors, one of the most alarming situations is what's known as a hypertensive crisis. This occurs when blood pressure rises to extremely high levels and may begin causing immediate damage to organs. At this stage, the risk isn't just long-term harm. The danger becomes immediate. The brain, heart, kidneys, and eyes can all be affected. What's particularly concerning is that some people experiencing dangerously high blood pressure still don't recognize the severity of the situation. They may dismiss symptoms as stress, fatigue, or simply part of getting older. Others may have no symptoms at all until a major event occurs. This brings us to an important question. Is there a single blood pressure number that is the most dangerous? In many ways, the answer is not one specific number, but rather any reading that remains severely elevated and untreated. The longer those high pressures persist, the greater the cumulative damage. It's not only about reaching a dangerous threshold, it's about allowing that pressure to continue day after day, month after month, year after year. Another factor many seniors overlook is consistency. Blood pressure that frequently spikes can also be problematic. Some individuals have readings that appear acceptable at times but soar during periods of stress, illness, or medication changes. These fluctuations can place additional strain on the cardiovascular system and deserve attention as well. The key takeaway is that cardiologists aren't just looking at a single measurement. They're evaluating patterns, trends, and overall risk. A reading that might seem only moderately elevated today can become far more concerning if it remains uncontrolled for months or years. That's why understanding your numbers and working with your healthcare provider is so critical. The goal isn't simply to avoid an emergency room visit. The goal is to prevent the silent damage that often starts long before symptoms appear. The most dangerous high blood pressure is the one that's ignored until it's too late. Now, after talking about the dangers of high blood pressure, I want to discuss something that often surprises people. Many seniors assume that lower blood pressure is always better. They hear so much about the risks of hypertension that they begin to think the lower the number, the healthier they are. But the reality is more complicated, especially after the age of 60. In fact, blood pressure that drops too low can create its own set of serious health risks. While high blood pressure may damage the body slowly over time, low blood pressure can sometimes create immediate problems that affect safety, independence, and quality of life. Blood pressure has one critical job: delivering oxygen-rich blood to every organ in the body. When pressure falls too low, organs may not receive the blood flow they need to function properly. This is particularly important for the brain. The brain is highly sensitive to changes in circulation, and even a temporary reduction in blood flow can produce noticeable symptoms. Many older adults first experience this when standing up from a chair, getting out of bed, or rising too quickly after sitting for a long period. They suddenly feel lightheaded, dizzy, or unsteady. Some describe it as the room spinning. Others feel a moment of weakness or confusion. These episodes may last only a few seconds, but they should never be ignored. The reason is simple. Falls are one of the greatest health threats facing seniors today. A brief episode of dizziness may seem harmless, but if it causes someone to lose balance, the consequences can be severe. Hip fractures, head injuries, lengthy hospital stays, and loss of independence often begin with a single fall. This is why cardiologists pay close attention not only to blood pressure that is too high, but also to blood pressure that may be dropping too low. The goal is balance. We want pressure low enough to protect the heart and blood vessels, but high enough to maintain healthy circulation throughout the body. One of the most common causes of low blood pressure in older adults is medication. Many seniors take medications to control hypertension, and these treatments can be life-saving. However, there are situations where blood pressure may become overly controlled. A dosage that was appropriate 6 months ago may no longer be ideal today. Weight loss, dietary changes, improved health habits, or other medical conditions can all affect how the body responds to medication. Dehydration is another major contributor. As people age, the sensation of thirst often becomes less reliable. Some seniors simply do not feel thirsty even when their bodies need fluids. Hot weather, illness, diarrhea, vomiting, or certain medications can worsen the problem. When fluid levels drop, blood pressure can fall as well. There are also underlying medical conditions that may contribute to low blood pressure. Heart rhythm abnormalities, certain neurological disorders, hormonal imbalances, and circulation problems can all play a role. That's why recurring symptoms should never be dismissed as just getting older. Another important point is that symptoms can be subtle. Not everyone faints or experiences dramatic dizziness. Sometimes the signs are much less obvious. Persistent fatigue, difficulty concentrating, blurred vision, weakness, or a feeling of instability while walking may all indicate that blood pressure is not adequately supporting circulation. What makes this issue particularly challenging is that some seniors become so focused on lowering their blood pressure that they don't recognize when it has gone too far in the opposite direction. They see lower numbers on the monitor and assume everything is improving, but numbers always need to be interpreted within the context of how the body is functioning. The healthiest blood pressure isn't necessarily the lowest reading. It's the reading that allows your heart, brain, kidneys, and entire body to receive the blood flow they need while minimizing long-term cardiovascular risk. As we continue, you'll see that blood pressure management is rarely about chasing one perfect number. It's about finding the safest range for your individual body and maintaining that balance over time. Because when blood pressure falls too low, the danger isn't always what happens inside the arteries. It's what happens when the world suddenly starts spinning around you. This segment is designed to transition naturally from the discussion of dangerously high blood pressure into the often overlooked risks of blood pressure that becomes too low in seniors. At this point, we've talked about the dangers of blood pressure that is too high and the risks that can come when blood pressure falls too low. But now I want to focus on something many seniors have never even heard of, despite the fact that cardiologists pay very close attention to it. It's called pulse pressure. And in many cases, it can reveal important information that traditional blood pressure discussions often miss. When most people look at a blood pressure reading, they focus on whether the numbers seem high or low. They might see a reading like 150/70 and think only about the top number being elevated, but there's another piece of information hidden within those numbers. Pulse pressure is simply the difference between the systolic pressure, the top number, and the diastolic pressure, the bottom number. In the example of 150/70, the pulse pressure is 80, and that gap can tell us a great deal about what's happening inside the arteries. As we age, our arteries naturally become less flexible. In younger adults, blood vessels expand easily when the heart pumps blood and then relax smoothly between beats. This flexibility helps absorb some of the force generated by the heart. But over time, arteries can become stiffer. When that happens, the top blood pressure number often rises, while the bottom number may stay the same or even decrease. The result is a wider gap between the two numbers. This is why pulse pressure becomes especially important after age 60. A widening pulse pressure can be a sign that the arteries are losing elasticity. In many cases, it's not simply about one blood pressure number being too high. It's about what those numbers are revealing about the overall condition of the cardiovascular system. Think of healthy arteries as a flexible garden hose. Water flows through it smoothly because the walls can expand and adjust to changes in pressure. Now imagine that hose becoming rigid and stiff. The force of the water has nowhere to go except directly against the walls. That's similar to what can happen inside aging arteries. What makes this particularly important is that a wide pulse pressure has been associated with an increased risk of cardiovascular problems. It may indicate that the heart is working harder to move blood through less flexible vessels. Over time, this added strain can contribute to heart disease, circulation problems, and other complications. Many seniors are surprised to learn that a blood pressure reading can appear somewhat acceptable at first glance, while still raising concerns because of the gap between the two numbers. That's why cardiologists rarely evaluate blood pressure based on a single number alone. They look at the entire picture. Another reason pulse pressure matters is its relationship to blood flow throughout the body. When arteries become stiff, the normal cushioning effect they provide begins to diminish. This can affect circulation to important organs, including the brain and kidneys. Over many years, those subtle changes may contribute to health issues that gradually impact quality of life. The challenge is that pulse pressure doesn't produce obvious symptoms. Just like many other cardiovascular risks, it often develops quietly. Most people don't wake up one morning feeling that their pulse pressure has widened. They continue with their normal routines, unaware that changes are occurring inside their blood vessels. That's why regular blood pressure monitoring remains so valuable. Every reading provides more information than most people realize. It's not just a pair of numbers on a screen. It's a snapshot of how the heart and blood vessels are working together at that moment. Now, I want to emphasize something important. A wide pulse pressure is not a diagnosis by itself. It doesn't automatically mean that a person has a serious medical problem. Rather, it's one clue among many that healthcare providers use when assessing cardiovascular health. The goal is not to become alarmed by every number, but to understand what those numbers may be communicating. As we continue our discussion, you'll see that blood pressure is about much more than simply avoiding high readings. It's about recognizing patterns, understanding warning signs, and identifying risks before they become emergencies. Because sometimes the most important number isn't the one that's high or low, it's the gap between them that tells the real story. By now, we've discussed several blood pressure patterns that can place seniors at risk. We've talked about readings that are too high, readings that are too low, and even the hidden significance of a widening pulse pressure. But perhaps the most important topic of all is knowing when blood pressure has moved beyond a long-term concern and become an immediate threat. The reality is that our bodies often give us warning signs when something is seriously wrong. The problem is that many people either don't recognize those signals or assume they're caused by something less serious. They blame stress, fatigue, aging, or a busy day, and hope the symptoms will pass on their own. Unfortunately, when it comes to blood pressure-related emergencies, waiting can be dangerous. One of the first warning signs that should never be ignored is a sudden, severe headache, especially if it's unlike anything you've experienced before. Many people describe it as intense, overwhelming, or appearing out of nowhere. While headaches can have many causes, a dramatic headache accompanied by elevated blood pressure may signal that something more serious is occurring. Another symptom that deserves immediate attention is chest pain or pressure. The heart relies on a constant supply of oxygen-rich blood. When circulation becomes compromised, the body often sends a very clear message. Some people experience tightness, squeezing, burning, or discomfort in the chest. Others notice pain spreading into the arm, shoulder, jaw, neck, or back. These symptoms should never be dismissed as simple indigestion or muscle strain without proper evaluation. Shortness of breath is another important warning sign. If breathing suddenly becomes difficult during activities that normally cause no problems, or if shortness of breath occurs even while resting, it may indicate that the heart or lungs are under significant stress. This symptom deserves prompt medical attention, particularly when it appears alongside abnormal blood pressure readings. Vision changes can also be a red flag. Blurred vision, double vision, loss of vision, or unusual visual disturbances may occur when blood pressure affects blood flow to the eyes or the brain. Many people don't immediately connect vision problems with cardiovascular health, but the relationship can be very significant. Confusion, difficulty speaking, or sudden problems with memory and concentration are equally concerning. These symptoms may suggest that the brain is not receiving adequate blood flow or could indicate the early stages of a stroke. Family members are often the first to notice these changes. A loved one may suddenly seem disoriented, unable to find words, or unusually confused about familiar situations. Weakness or numbness affecting one side of the body is another warning that requires immediate action. If an arm, leg, or part of the face suddenly feels weak, numb, or difficult to control, every minute matters. Quick treatment can dramatically improve outcomes in certain medical emergencies. One challenge for seniors is that symptoms don't always appear dramatically. Sometimes the signs are subtle. A person may simply feel unusually tired, dizzy, unstable while walking, or generally unwell. These changes may not seem alarming at first, But when they appear suddenly or occur alongside abnormal blood pressure readings, they deserve attention. I often remind patients that there's a difference between routine monitoring and emergency symptoms. A mildly elevated blood pressure reading on a home monitor doesn't automatically require a trip to the emergency room. However, when dangerous symptoms accompany abnormal readings, that's a very different situation. It's also important to trust your instincts. People know their own bodies. If something feels significantly different, unusual, or concerning, it's better to seek medical advice than to ignore the warning signs and hope they disappear. Too many serious cardiovascular events happen because people wait. They tell themselves they'll see how they feel tomorrow. They decide to rest for a few hours. They convince themselves that the symptoms aren't serious enough to warrant attention. Sometimes that delay can make all the difference. The goal is not to create fear. The goal is awareness. Most blood pressure problems can be managed effectively when recognized early, but recognition requires paying attention to the signals your body is sending. As we move into our final discussion about protecting blood pressure and reducing long-term risk, remember this: numbers on a monitor matter, but symptoms matter too. Together, they tell the story of what your body is trying to communicate. Because when your body starts sending warning signals, the safest response is to listen before it has to shout. As we come to the end of our discussion, I want to leave you with something encouraging. We've spent time talking about dangerous blood pressure readings, warning signs, hidden risks, and the serious consequences that can occur when blood pressure is not properly managed. But the most important message is this: there is a tremendous amount that seniors can do to protect themselves. The goal isn't to live in fear of every blood pressure reading. The goal is to take control of the factors you can influence and make decisions that support your health day after day. One of the most powerful habits you can develop is simply knowing your numbers. Many people check their blood pressure only during doctor's appointments, which may occur a few times each year, but blood pressure can change over time. Monitoring it regularly at home provides valuable information and helps identify trends before they become serious problems. Just as importantly, keep a record of your readings. A single measurement tells part of the story. A pattern tells much more. When you bring those records to your healthcare provider, you're providing information that can help guide better decisions about treatment and care. For those who take blood pressure medication, consistency matters. These medications work best when taken exactly as prescribed. One of the most common reasons blood pressure becomes difficult to control is that doses are skipped, delayed, or stopped without medical guidance. Sometimes people feel better and assume they no longer need treatment. Others become discouraged by side effects and discontinue medication on their own. The truth is that blood pressure management is often a long-term partnership between you and your healthcare team. If concerns arise, adjustments can usually be made, but those conversations need to happen before changes are made independently. Lifestyle choices also play a major role. The good news is that even small improvements can produce meaningful results over time. Physical activity is one example. You don't have to train for a marathon or spend hours in a gym. Regular movement, whether it's walking, gardening, swimming, or another enjoyable activity, helps support circulation, heart health, and overall well-being. Nutrition is equally important. A diet rich in vegetables, fruits, whole grains, lean proteins, and healthy fats provides the body with the nutrients it needs to function effectively. At the same time, reducing excessive sodium intake can help many individuals maintain healthier blood pressure levels. Sleep is another factor that often gets overlooked. Many seniors accept poor sleep as an unavoidable part of aging, but chronic sleep problems can affect blood pressure, heart health, energy levels, and overall quality of life. Prioritizing restful sleep is not a luxury. It's part of protecting your cardiovascular system. Stress management deserves attention as well. Life continues to bring challenges at every age. Family responsibilities, financial concerns, health issues, and daily pressures can all affect emotional well-being. While it's impossible to eliminate stress completely, finding healthy ways to manage it can make a significant difference. Activities such as walking, spending time with loved ones, hobbies, relaxation techniques, or simply taking time to unwind can help reduce the burden that chronic stress places on the body. Another important habit is staying connected with your healthcare providers. Regular checkups allow potential problems to be identified early, often before symptoms appear. Prevention is almost always easier than treatment after complications develop. And perhaps most importantly, remember that blood pressure management is not about perfection. There will be days when your numbers are not exactly where you'd like them to be. There will be setbacks, adjustments, and challenges along the way. What matters most is consistency over time. Every healthy meal matters. Every walk matters. Every medication taken as prescribed matters. Every blood pressure check matters. These small actions may seem insignificant on their own, but together they create powerful protection for your heart, brain, kidneys, and overall health. When people ask me what the most dangerous blood pressure is for seniors over 60, my answer is often the same. The most dangerous reading is the one that goes unnoticed, ignored, or unmanaged. Because once you know your numbers, understand your risks, and take action, you place yourself in a far stronger position to protect your future. Your blood pressure may influence your health, but your daily choices help shape the outcome. Protect your numbers today, and you protect your independence tomorrow.